Enjoy yourself a little. Indulge.
Confetti wine. Candy cameras. Here, I'll
That actually looks really good.
try a confetti cake. Pretty freaking good. That one.
I have a piece of each.
He came in for retching and gagging. So it's a combination of kind of respiratory signs, but also maybe a GI component. So we're gonna do a CT of her chest and then an upper GI endoscopy.
Just bring him over here so I can look. Well, he's been vomiting, regurgitating, and his stomach packed a few months before all this happened. I didn't know if he was going to have ulcers or a tumor, inflammatory bowel disease, or it's just that his stomach's hacked in the wrong spot. Anything around it, it's just so much. It is pretty huge. So I'm biopsying different areas of his stomach to see if he has another underlying cause for this clinical sign.
So we've got a 1-year-old male neutered, thank you, poodle that is here for a closed comminuted left humeral fracture, and we're gonna go fix it. It's gonna be great. Shoo.
So Sully was a recent patient at Guardian Veterinary Specialist that actually had a little too much excitement associated with 4th of July weekend. He found himself chasing a golf cart and somehow managed to get himself rolled over by one of the tires. When he was rolled over, his left forelimb got stuck under the tire and actually caused a fracture of the humerus. The humerus is the proximal forearm bone that basically connects the shoulder to the elbow. In this image you can see here that there's a humeral fracture that goes right through the middle and it's in several segments. So this type of fracture is actually a very complicated fracture to fix in veterinary medicine. That's typically because the humerus is covered by a lot of muscles and it's difficult to get to ensure that we get good stabilization. Also, the radial nerve passes right over this area, and the radial nerve is one of the most important nerves of the body to allow for weight bearing and standing. So this particular injury is one that when we find it, it's not something we can actually put a splint on. We recommended surgical stabilization, and in Sully's case, we took him to surgery. Sully had a particular type of repair called a plate rod. We were able to place a long pin right down the middle of the fracture, and then also place a very strong stainless steel plate with screws above and below the fracture right next to this pin. So this type of stabilization repair is one that's very strong and secure, especially for this particular bone. This is a great technique to allow Sully to get motion back in the leg, place some weight bearing, and allow the radial nerve and the muscles to heal. Sully's doing very well. He's now 1 day post-operative, and we're very happy with his kind of overall recovery. We hope that he goes on to a very healthy, long life, and we suspect, since he's a puppy, that this is going to heal very nicely, and all the fragments will begin to glue back together and it'll look like a normal bone. He will keep this plate and rod in here indefinitely unless there's a problem that we have to remove it. But other than that, Sully's doing well today, and we're very happy.